We are here today training the people to understand clearly universal health care coverage and at the same time to understand social accountability. Social accountability as it is, it's a process, a governance process whereby the citizen engage with the public or their leaders so that they can be able to understand what is there for them, what is their role, what has the government recommended that they get in terms of universal health care coverage.
We have got very solid systems that this is our structure for public participation. These are the resources we have for public participation. These are our calendar events for public participation. Do we have those? Process may not be so much internalized. The capacity may not be sustained. It could be, in fact, in most cases, it is more of a technical assistance than capacity building. When we look at issues of accountability, sometimes the authorities may view it as a way of exposing their weaknesses to the communities.
Because the Constitution is beyond all, it's the law of the land and must be honored if people are going to be successful. Why can't we get information? In fact, even today, as we are saying, the budget got late. We don't know whether it got late. We never got the schedule. Anybody who got the schedule that the national government said will release money at this time, none of us. So we must demand that information is released, is availed, and availed on time.
Yes.
And in a language that Wanjiko can understand.
As civil society organizations, what are our opportunities to make sure that this issue is adequately addressed? What are our options?
For instance, in the budget making processes, there is the CBEF. That's a forum where, as CSOs, we need to have representatives. And these representatives are not supposed to be appointees by the counties, for instance. It is us CSOs who are supposed to elect our own representatives to be part of the CBEF because they have a say in the budgets at the county level.
The provisional budget, when it is shared and then the public give input into it. Eventually, when the budget is finalized, do people have access to it? Are they able to access it and to scrutinize if what they set as priorities are what have been captured?
If you look at the size of the document and the time that is given to the public to go through it and participate on it, for real it is being done for formality, because most of them, if you ask them what was in that document, they don't know.
For UHC to be effective enough, I think it calls for all a consolidation of efforts from the Ministry of Health, the CSO working on health issues, and again push for key policies that needs to be addressed on matters of health, because you find that allocations are there, but again, how have the allocations been used? Do we have the implementation reports from the ombudsman or from the health department, so then we can get to see from the allocations, this was spent, this was not spent, you see. So I think it really calls for all consolidated efforts and real partnership from CSOs and even from the Department of Health. So then we can work as a team to help bridge the gaps that are there.
And despite the fact that Article 35 of the Constitution actually demands that we Kenyans access information. In fact, not even the civil society alone, but the citizens in this country must access information. We must know what is it that is budgeted for. We must know packages that we have been given, even universal health care coverage. We must know how the money is being used. I think this is not something that we want to discuss what to do. I think what we are saying, we are not very happy as the civil society and citizens in this country because we have been denied that right for so long. So our request and our demand is that we get the government ensure that we access the information. We want when we go to the website, we are able to access information on what is happening in the health sector in every given county. I don't want to talk about counties, but I would mention Makueni, for example. If you go to our website, you can get as much information as possible. So we are requesting even publication. We want that information to be publicized. And we are saying, can publication be done in a language that we can understand, including our mother tongue, so that all of us can be able to know what is it that exists and how do we demand for it and where do we go for it. because the services are ours. Many people do not even understand what is this UHC all about. I know people in the pilot counties like Kisumu, they have even UHC card. But you talk with people and they are telling you, I don't know what this card is for, I've not used it, you know. And then again, the same problems that were facing us even before the UHC came on board, they are still facing us. You go to the health facility, you find there are no drugs. At the same time, the same problem that was facing us about human resource in the health facility is still a problem. So it can only become be said to be a success if the systems and structures have improved and the services have improved and the quality of treatment has improved. You know, a research was done recently, and what we are realizing that people are not dying in this country, for example, in Kenya, because of lack of access to services, but because of quality. People are misdiagnosed, you are given drugs that do not make any transformation in your body, but at the same time, we are saying UHC, number one issue is quality. So to me, we still have a long way to go. In regards to social accountability, what we want to see is that the citizens, they have clear understanding of the provisions that are there for them in the universal health care coverage, and that they have a role for demanding for the services, and that the civil society in particular, they are able to advocate and follow up in terms of quality, access, and financing. As you know, in the universal health coverage, what we're looking for is to ensure that people are able to access quality services with less challenges and with less finance burden.